What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for March 22, 2021. This is Our Shot, a digital campaign to end the pandemic, one vaccine at a time. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to doctors Jay Bhatt and Hussein Lalani about how important physicians can be in influencing others to get COVID-19 vaccines. They discuss how doctors can counter misinformation, listen to patients with compassion, and how they have started a social media movement to highlight vaccine champions. Let's listen.
Jay Bhatt and Hussein Lalani, thanks so much for joining me.
Great to be with you.
Thanks for having us.
So today I want to talk about the role of trusted influencers in getting COVID vaccine to people and getting patients to understand the value of being vaccinated. I'll start with you, Hussein. Talk to me a little bit about sort of the role that physicians and other clinicians should play in this vaccine rollout and what role they are playing.
Well, thank you for having this such important conversation. Anytime there's something new that's available in society, like the vaccine, for example, people have questions and they turn to those who they trust. And physicians have a really important role to play as trusted messengers when it comes to the vaccine. People trust their doctor. They don't just trust any doctor, but they trust their personal doctor to provide them with good medical advice that pertains to them. And they want to know what their doctors think. And as a result, we think that doctors have an important role to share the value of the vaccine, to emphasize that it's safe, that it's effective, to share side effects that patients can expect to experience, and to answer their questions.
Jay, how should doctors talk about vaccines with patients? What kind of questions are they asking and what kind of responses are you giving and should others be giving?
Thank you for having us. And I think that Hussein hit it spot on. I mean, some of the questions are really about what are some of the side effects of the vaccine? How long will it protect me? How does the vaccine impact symptoms I may feel? Can I go out and do different things like hug my grandmother after I've been vaccinated? Can I, be safe from the vaccine? And then there's questions because of what happens in the community and how information or misinformation gets spread as myth as to whether DNA is injected or, a vaccine creates a number of different conditions. And so I think that what's important is that we give them the science in a way that they can understand. So I think that often as physicians, we can get caught up in explaining or conveying information in language that doesn't meet your patient or family member community where they're at. And so as someone who works in underserved communities, it's so important that we relate this to not only common language, but also aligning health goals with life goals. So what is your why? What do you want to be able to do? And so then that's how I orient it. And just, we've had a history of actually vaccines, measles, mumps, rubella, polio, being taken by communities of color, children's vaccines being taken by communities of color, and so I think we can draw upon those experiences for this vaccine, which is safe and effective.
You just mentioned communities of color. And so I want to ask Hussein if you think that sort of Black and Hispanic physicians sort of have an extra job here.
Yes. Obviously the pandemic has disproportionately affected our communities of color, our Black, Hispanic communities, and they trust their doctor and they're more likely to trust someone who looks like them. And that's bared out very clearly in the data as well. And so we need our Black physicians, our Black nurses, our Black pharmacists to be out there advocating for the vaccine and talking about it with their communities. And I know they're doing that. There's tremendous efforts happening to connect with people. Just recently, the Black Coalition Against COVID released an amazing conversation series digitally between us, about us, where they're having open conversations and answering really important questions directly with the Black community.
Mm-hmm. Jay?
Yeah, I agree that the conversation series is fantastic. It's people that look like people from the community that are sharing these trusted messages. And I think, the other thing I've seen most recently when I was vaccinating a large number of people in an underserved community in Chicago was that often family members become the first one to take it and then share their experience with others in their family. And that's been helpful. I've been actually very encouraged by the turnout in some of these communities where people are coming to get the vaccine, and they're doing it together sometimes, mother and daughter, grandmother and niece. It's really just interesting, siblings coming together, partners coming together. And I think that the more that we can tell those stories, continue to have healthcare heroes share their experiences of how their shot and the shots that their patients have gotten have been helpful and allow them to get back to the things that they want to do in their lives, the more I think we'll make progress. And I think the other thing is, for communities of color, in order to level the playing field, we got to go low tech. It's been so hard for people to get appointments, but actually meeting the community where they're at in a place that's familiar to them, whether it's their doctor's office or church or places where they live, work, learn, and play, those are going to be helpful to moving us forward.
Did you have something to add, Hussein?
Stories are incredibly powerful, much more so than data for many people. And that's why Jay and I are proud to be leaders of a national grassroots social media movement called This Is Our Shot, that aims to build vaccine trust and fight misinformation to reach a COVID-free world. And we encourage all trusted messengers, whether in healthcare or otherwise, to share their story and help people build that connection and understand their experience. In fact, a recent polling shows that people are more comfortable to take the vaccine. 66% of people are more comfortable to take the vaccine once they've seen someone who they know take the vaccine first. And so, in addition to encouraging people to share their story, we also create fun, easy to use social media content that's informed by quality research and evidence-based messaging to spread widely and to really provide a counter narrative to a lot of the myths and misinformation that's out there.
Mm-hmm. And This is Our Shot. Is that what this is called? Tell me a little bit more about sort of why you created it and what someone might find.
Absolutely. So This Is Our Shot was founded by frontline healthcare doctors who noticed that their patients had a lot of questions about the vaccine and that they valued their opinion. And simultaneously, based on the realization that over 50% of people receive their news digitally. And so traditionally, trust building has happened in person, one-on-one in the community. But with the physical distancing that COVID has brought upon, along with the massive change in the way people consume information over the last decade, social media has become an incredible opportunity to communicate information and to connect with people. And so the movement was founded really in a very grassroots way and has spread across the country, attracting healthcare heroes and health heroes to share their story, to share evidence-based messaging, and to really connect with people.
Mm-hmm. And people are essentially telling their stories about their vaccine, about why you should get your vaccine. Is that the idea?
Yeah, it started off as the vaccine selfie. People would get their vaccine shot, they would share their selfie, and they would share their experience. And then we've had multiple, campaigns along the way where we, have people, for example, share their My COVID resolution in January, and around Valentine's Day, share who they love in their family and wish could get the vaccine next when eligible. And so we're trying to use common events, but also ways in which we can connect with folks to spread valuable information.
Jay?
Yeah, I think Hussein said it right. We're really proud to be a part of this team and growing that community. of healthcare leaders that are sharing their experience of their shot, but also what that experience means for them as healthcare workers to be able to care for more people, to be able to do the things that they want to do to take care of folks safely and be with their families. And I think it's building not only this community digitally through social, but it's also building tools and story banks that can be used on the ground in a grassroots way. So it's, we're building training tools so that folks understand how to maybe engage with those that might not feel the same way on social or on the ground, but also using trusted, tested messages in their clinics and in the hospital, in the community. And so I think that this is our shot, also draws upon, I think, this moment, the very best of humanity, and to know that, this is our shot to get out of this COVID pandemic and into a COVID-free world.
So we're running low on time here. I did want to talk about misinformation and disinformation and sort of how we combat that, and sort of what do we know about how people take in these messages and how damaging they can be, Hussein?
Well, we know that misinformation spreads rampantly. It spreads, often the lies spread much faster than the facts do. And it's targeted, it's coordinated, and unfortunately it is affecting our communities of color intentionally, which is very dangerous. And it spreads fear, and it makes it very challenging for people to trust what's going on in life, and they start to question a lot of things. And so we've seen the recent reports from the Wall Street Journal about how Russian intelligence agencies are also publishing false information about the vaccine. And the important thing here is that we should keep in mind is that first, it's important to pause and look at what you're reading before you start sharing it. And this is a common campaign that Purpose, the World Health Organization, has put out in terms of how to combat misinformation. So take a second, pause, look at what it is that you're reading, and decide whether that's something that really should be shared. And second, don't feed the trolls, as we say, because when you, as someone who has a community of influence, shares what someone else has put out there, now all of a sudden you've amplified their microphone. So instead, focus on your message. Focus on sharing quality, evidence-based information about the vaccine, sharing your story, and answering important questions people have.
And I would say that Hussein's spot on with those comments, and that we also use insights and evidence. For example, there's new studies that come out every week that reinforce the safety of the vaccine, the efficacy of the vaccine, the fact that adverse or allergic reactions are even more minimal than we originally thought. And so with that additional data, and as people get more comfortable, I think it's our job to lift those things up to fight misinformation or disinformation.
We are publicly launching this campaign this week. And so we want to unite all trusted messengers and vaccine advocates, who we call health heroes, to come together to share their story, to share quality information, and to really end this pandemic together. I mean, ultimately, this is our shot to open schools safely, to spend quality time with our friends and family, to get back to concerts and sporting events, to start doing the things that we love that we haven't been able to do for the past year. So we encourage you and invite you to join us. Visit our website at thisisourshot.info and join us.
Jay Bott and Hussein Lalani, thank you so much for joining me.
Thank you for having us.
Thanks.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.